Hello, I am Dr. Meghana, Clinical Head and Fertility Specialist at Oasis Fertility, HSR layout. Does IVF pregnancies always end up in twins? This is the most common question which is asked by most of our patients. The answer to this is no. All IVF pregnancies need not end up with multiple pregnancies. There are ways and means by which we can avoid multiple pregnancies, either in the form of twin pregnancies or triplet pregnancies, and the ensuing complications. The answer to this is single embryo transfer. Unlike an IUI cycle where when multiple follicles are formed, there is a chance of higher order pregnancies either in the form of twins, triplets, or even sometimes quadruplets. In an embryo transfer cycle, we have the ability to choose the best embryo and transfer that one single embryo to give a singleton pregnancy. Nowadays, with good laboratory facilities, we are able to take most of the embryos to the blastocyst stage. That is, grow the embryos in the lab till 5 days and then either do the fresh embryo transfer or a frozen embryo transfer. So, with a transfer of a good singleton blastocyst, the chance of success with IVF pregnancy is almost equivalent to transfer of 2 or even 3 cleavage stage embryos, that is day 3 embryos. When we say the success rate is approximately 60% per cycle, it is considering the fact that we have good blastocysts. So transfer of a single blastocyst ensures that we get a singleton pregnancy, that is only one baby ensuing in one pregnancy. With this, we end up having lesser complications in the form of no cervical incompetence in most of the cases, whereas with twins or triplets, there might be a need to do a cervical stitch in the second trimester, that is at around 16 to 20 weeks of pregnancy. These women who have multiple pregnancies can have a higher incidence of hypertension in pregnancy, diabetes in pregnancy. No doubt, even women with natural conception or an IVF conception with a singleton can also have these complications, but per se, the iatrogenic complications because of having twins can be reduced to a great extent when we transfer only one embryo. Along with that, we also know very well that twins or triplets can have preterm delivery, that means delivery before 38 weeks of pregnancy, which can also be avoided with these singleton pregnancies. Also, the chances of NICU admissions, preterm deliveries, IUGR in these babies can be avoided to a great extent when we transfer a single embryo. So, it doesn't mean that all IVF pregnancies have to end up as twin pregnancies, though it's very nice to see that there are twins, but it has its own complications during the antenatal and also the early neonatal period. To avoid these complications, the answer is single embryo transfer.